welcome Jack Knott to the first in our series, America in Crisis. Can you tell our viewers who you are?
Yes, I'm Jack Knott. I'm the Dean of the USC Saul Price School of Public Policy and Professor of Public Policy.
Thank you for joining us. So I'm just going to start with our 5 questions. And the first one is sort of open-ended because we wanted to get an idea of the spectrum of how everyone is doing. So what are you feeling right now?
Well, I'm feeling a mixture of anxiety and worry, sadness, and real concern about the future, especially for everyone's safety. Immediately here, at USC with the faculty, staff, and students and our families, but also growing concern and on a daily basis for what's happening across the country and around the world. And anxiety about the global south and what's going to happen if this virus gets really infected into countries that don't even have the infrastructure that we have, the healthcare infrastructure or other kind of infrastructure, and the kind of devastation. So it's a pretty challenging, sad time and great uncertainty for the future.
And leading in uncertainty is its own challenge.
Yeah, so that's on the one side. On the other side, I've been amazingly encouraged by, even in our own little community here, how people have come together, have worked hard. All our courses have gone online. We're working from home. We're sharing, we're interacting. I've just been amazed by people's resilience and the commitment they have to each other and to our students and to our mission. So that's been really very, very encouraging. And you also see some of that around the world as well, with people on balconies cheering for the healthcare workers or singing songs to each other, things like this. So even in the midst of all of this uncertainty and sadness, there are really important human positive qualities, wonderful things about how we are together as a people. And so I'm encouraged by that, knowing that we'll get through this and our humanity in the end will prevail.
Yes, thank you for the bright side. So, I think obviously we're all rethinking, that we really do have to think about healthcare policy. So other than healthcare, what's one policy area that you think we as a country, as a locality, really need to rethink as a result of this crisis?
Well, there's both a policy area and, to me, a broader issue. The policy area that I think is really critical here is social policy and inequality. When you see how we made reference to that at the beginning, some people still have jobs and income, but there's growing large numbers of people that are living paycheck to paycheck. They didn't have any savings. They don't have a social safety net, and they're at risk. And that's a just growing number of people. And what happens is, in a crisis, the kind of extreme inequality that we have in the country and lack of a full safety net gets magnified. The problems of that get hugely magnified. And so I think we need to seriously think about some major, more, bolder kind of approaches. One that I like is Nicholas Berggrun's idea of pre-distribution, in which, when companies are started, everybody gets a stake in these companies. Now, the stock market has gone down 30%, but still, if everybody had a stake, they would have assets, and that's what they need. Or even Andrew Yang's idea of guaranteed income for everybody, or we need to start thinking of ways of supporting people in a bolder way in terms of social policy that is broader than just health. Health is obviously huge here as well. But and then secondly, I feel we need to really look at governance. There's been a series of governance failures, and certainly on the global scale. This is one of those true global crises. And it's not like war where states are fighting against each other. And it's not even like climate change where you may have developing countries, wanting to develop and rich countries wanting to preserve the environment. But this is a case where we're all basically in the same boat. Right. And we all would benefit from working and collaborating, and we haven't been able to do it. And it's been a huge governance failure at the global level. But even within our country, the kind of things we're experiencing, competition for and bidding up prices for medical equipment, things like this, parts of the country not conforming to social distancing, and some parts doing it. There's a lot of we have protocols for that we routinely do, at least here in California, for earthquakes or fires. But we're not thinking strongly enough about disasters and governance issues involved in them. So those are two very important areas that I think need to be looked at, and we need to start thinking about seriously beyond our healthcare system.
Thank you, and thank you for bringing up governance. I mean, that is clearly, good governance can save lives, and bad governance, as we see, can do the opposite.
Yeah, no, that's absolutely the case. People tend to look at just technology. But that's not the answer. It's an important component of the answer. But having the right governance and effective governance is really just as critical, if not more critical, to being able to save lives.
Okay, so that sort of brings us to our third question, which is, what is one source of information that you trust regarding the virus and our governmental actions, and why do you trust the source?
I don't know if there is just one source of information, but I tend to trust, at least in the U.S. context, the Center for Disease Control. Mm-hmm. They are a very reputable organization. I've worked with them in the past. I've done health at-risk surveys when I headed the survey center at another university, and they're very professional, very high-quality people in it. Tend to trust their information. Globally, I would look to the World Health Organization as a source of trustworthy information. And in general, in this kind of situation, I'm looking for university expertise or scientific information. And it's become apparent that, you can politically define what the world is like, but when you're facing a situation like that, that eventually becomes just a real danger to everybody. And so having people who have expert knowledge, have a professional approach to this rather than a partisan approach, people who have a lot of experience with national and international disasters, that's where we really need to trust their information and what their projections are. And I wish we had done that earlier on, both here and in other countries around the world.
I agree. The CDC released their first press release on the virus on January 8th.
Yes, no, that's right. When you look back, that press release, and then the World Health Organization is there, declaring this, and first a kind of a global emergency, and then a real global health crisis, that came before, at least in the United States, we were taking the kind of actions needed in order to address it. So having paid attention, that's very similar to in China. You know, the scientific warning was there.
Right.
The experts knew what was happening in Wuhan, but the governance system did not respond until much later. So
Yeah. And I mean, and it has been mirrored in different countries, including our own, since then.
yes, no, exactly. It's been mirrored in one country after another, and so this it ought to be a really huge lesson out of this. That, and I'm hoping that, you know, who knows, that it carries over into other areas like climate change and et cetera, where experts and scientific consensus and knowledge is going to be a bigger part of policymaking than it has been recently.
I hope so. So our fourth question is sort of a retrospective, and for you, would you have changed the way you thought about price and research, and the focuses of what we do at Price if you had known what was coming? It's a hard question, but
Yeah, well, I thought about that in two different ways. I first thought about it in terms of my own research,
right.
you know, as a scholar, because I have a substantial part of my research is focused on regulatory agencies and the regulation of the economy, and the value of having semi-independent agencies like the Federal Reserve, for example, which in a sense is getting at the role of expertise in policymaking and how do you insulate that. And in the case of, for the Fed, for example, we're trying to develop policy that would be for the common good, not just for special interest, and also for the longer term, not just the short-term political benefit of printing money or whatever the political interest might be.
Right.
So I have written about that and the value, but also the limits of deregulation, focusing primarily on, you know, like FTC, FAA, you know, Fed, those kind of agencies. But even there, there's been pretty important failures. You know, if you just look at the recent Boeing MAX failure, part of that was that the FAA was, you know, relying on Boeing's and the industry's own safety inspections
Right.
for its regulation. So it's a challenge even in areas like that where we have, as a country over time, created institutions like these semi-independent regulatory agencies that are supposed to be somewhat insulated from politics. It's very hard even there to do. But I would have, you know, looking at where we are now, I would have spent more of my research effort trying to think about this in a broader context. How do we make sure that we assure the role of scientific expertise, professional judgment across different agencies? That was even brought to a head by me recently in this book by Michael Lewis called The Fifth Risk, where he goes through areas like nuclear power and agriculture and areas that we don't normally even see the kind of expertise that is there in the government, and how it's so easily overridden or ignored by the political process. So I would have, you know, have liked to look at this in a broader context, not just in the sort of economic regulatory area that I was looking in. You know, I've been thinking about this because, you know, we have a council of economic advisors for the president. That council should really not be made up just of economists. It should have an historian on it. It should have a scientist. You know, it should be a council of advisors that is weighing the kind of economic theory against all these other kind of risks. and potential things that are happening. So we're looking at ourselves more as a collective society and not just narrowly as an economy. So that's one from a personal point of view. I also think from the side of the Price School, we have had some work on the economic impact of terrorism or the economic impact of some natural disasters, but we've been thinking about it too narrowly. Yeah. Even though we have done a lot of that research, we are like totally unprepared and haven't done research on something like this. And so to rethink the kind of work that we might be doing on natural disasters and risk that is reconceived. And I really feel, I'm going to come back to governance again, I don't feel that we've had that as a school connected. We've been doing economic impact analysis and risk analysis, but we haven't connected governance to that in a broad-based way. And I think that's something we could and should be doing as a school. As a school, we're also the many dimensions of this, all the way from, looking at the social impact, the social safety net, the, inequality aspect, to the governance aspect, to the whole issue around, real estate and space. These are all dimensions that I don't think we've integrated quite enough, but we have an opportunity here to bring to bear these different perspectives. And I think we're starting to do that in some ways through the Bedrosian, the series, through the Luss Center of Real Estate. They're doing a series on this, and they're bringing in, experts not only from real estate, but from really across the school. And we need to look at this more holistically. So I'm hoping that helps us think through the kinds of things we should be doing as a school, where we integrate some of this kind of expertise and think more about how does governance relate to risk, how does risk and that relate to economics and health. And we have all that expertise, we just haven't brought it together in quite this way. And this may be the impetus to do that.
I actually think for universities in general, this is a way, a wake-up call to sort of incentivize collaborative research across disciplines, which, we don't do because it's, the journals are so specified that, the incentive for faculty to work across disciplines is difficult to overcome.
Yeah, no, I think it's both. There's disincentives in the professional academic communities to that kind of interdisciplinary problem-focused kind of research. Okay. There's also there's also a tendency to go into smaller problems that you can quantify, or you can more easily get your research methodology to show a cause effect, which is good. But we don't want to lose these bigger interconnections and the bigger kind of issues. One of the things that has struck me in my years at policy schools is how major changes, occur. Like, even going to fall of the Berlin Wall. Nobody was predicting that. The collapse of the Soviet Union, nobody was predicting that. You even go to the rise of terrorism in the way it did through 9/11. Nobody, we're studying all kinds of things, but that was a big shock to everybody. And more recently, the rise of populism and right-wing people, a lot of people studying politics, but I didn't read a lot of work saying, oh, we're entering this kind of phase or predicting this. It came on us. And now we, again, are really unprepared for something that's been sitting right there. So having these interdisciplinary and bigger conversations maybe is something that this will give us incentive to do.
And our last question is also focusing on expertise. I think there have been a number of new experts, authorities in different fields, leaders have emerged in different sectors and in different countries. So, who is a leader that you think has been doing exceptionally well during this pandemic?
Well, when I had thought about this question, I was not thinking of too that much about leaders in different sectors or scientists in different countries. But so let me start with just I think internationally. Lee Hsien Loong at Singapore. I've seen him interviewed and watched what they've been doing there. I think he, it's a small, it's a small city state, so it's not the U.S. or China or anything, but they they took very early on, a very comprehensive approach to this. They did extensive testing. When somebody was tested positive, they then did a lot of tracing of who that person had been with, and they created networks, and they've been very professional and scientific about their approach. Now they have, they're not as open a democracy as we are, and they're smaller, so they have some advantages. But even so, they did like I said, a very scientific, professional, comprehensive approach to this, and so I think he is one person. In the United States, I have to say, I know a lot of people are saying this, but I tend to agree with it. I think Governor Cuomo has been, given the context that we're in, somewhat chaotic context, has been a very articulate spokesperson, has laid out really, I think, convincing strategies and policies and plans. Now, he hasn't been able to implement those all because he hasn't had the resources and the cooperation and so on. But if you listen to what he says and his commitment to this, I think he's among political leaders in the U.S. Probably the most effective one. I also do think, out on the West Coast, to some extent, Governor Newsom and so on have been ahead of the curve for the, compared to other parts of the country.
Right.
So I admire that, but Governor Cuomo just, has stuck out for me. Also, I have to say that Dr. Fauci, even, given the context within which he has to operate and the highly politicized nature of what he's trying to do, has increasingly been effective in gaining the ear of the government, helping define the conversation, and so on. Whereas that was, a really tough hill to climb, and he's been persistent at it and has gained more and more respect, I think, for that. So I'm hoping that out of this, like I mentioned at the beginning, one of the biggest failures here is this is a true global crisis, and we had no global cooperation, no global response. It's like the United Nations doesn't exist as an organization. I didn't hear anything from the United Nations, World Bank, monetary. Those institutions have been invisible in all of this.
The United Nations just put out a report on how we should have a collaborative global. Yeah. But it's
too little, too late. Yeah. So I don't think there are a lot of good examples of strong leadership on this, but I feel scientists, including university scientists, experts, and then a small number of political leaders have, been effective in this crisis. I feel that Angela Merkel eventually, has come around and done a pretty, solid job of, rallying the country and taking the kind of measures that need to be taken, at least in a European context.
Yeah.
So there are some examples there, but they're not very many.
So to sum up, I would say that what you've said is that we want leadership that is for the public good, actually for the public good, to listen to expertise and more than just one field of expertise, but a sort of interconnected expertise. And also, in terms of Governor Newsom and Governor Cuomo, this feeling of empathy as well.
You said that well. It's and especially this last point of being able to communicate, connect with people, and show empathy for the incredibly stressful, tragic situations that many people are facing, and being able to articulate that and to provide leadership for us around that, I think is really, really important. And those two governors have exhibited that. I also, paying attention early on to professionals and expertise, recognizing that that's the nature of this crisis.
Yeah.
Also, trying to overcome the natural inclination to, protect us versus them, and us. We're all in. This is really a global crisis, and trying to overcome those collective action kind of problems. A leader that sees that and is willing to do that, I think that's very important in this situation as well. And then somebody who, this is a crisis. I'm sure Governor Cuomo doesn't normally spend half of his day the way he's spending them now, but you really need.
It's true for a lot of us. But yeah,
you need a crisis team, and you just need to prioritize this, and this has to be the thing that you do, and you have to get everybody rallied around that and make things happen that way, and that's not a normal operation. And so provide leadership to be able to bring those different people together, assets together, resources is a talent and a leadership skill that people should have also.
Excellent. So thank you very much. I really appreciate you doing this.
Yeah, thank you, Aubrey. I appreciated you asking me and for the opportunity to have this conversation with you on this important topic. Thanks.
Great. Thank you.